Now in this lecture, we are going to discuss the specific types of osteomyelitis. In the previous lectures, we discussed pyogenic osteomyelitis. Pyogenic type of osteomyelitis, particularly suppurative osteomyelitis. And we said that the causative microorganism is the Staphylococcus aureus. So the osteomyelitis discussed previously what we call pyogenic osteomyelitis. In this lecture, we are going to discuss specific types of osteomyelitis. That means the causative microorganism is specific. It is not Staphylococcus aureus and it is not pyogenic osteomyelitis. As we mentioned previously, that the pyogenic osteomyelitis of the jaw bones usually occurs due to infection, usually associated with dental infection. That means there is local infection within the jawbone. There is periapical infection, periodontal infection, or even pericordial infection. Or sometimes there is fracture of the jaws, fracture of the mandible, or even there is gunshot. And these facilitates the spread of the infection or establishment of the pyogenic type osteomyelitis. Here, in this condition, in case of the specific type, such as tuberculosis osteomyelitis, syphilitic types osteomyelitis, or actinomycotic osteomyelitis. Actually, the infection here, not within, they are not directly within the jawbone. Not occurs due to dental infection or within the or associated with dental infection, but the infection usually occurs in the area away from the jawbone, but the infection might be spread to the jawbone. For example, in case of tuberculosis osteomyelitis, the infection or the target of the bacteria or causative microorganism is the lung, but the infection might spread to the jaw bones. And also in case of syphilitic osteomyelitis or even actinomycotic osteomyelitis. So the infection spread through blood, hematogenous, or sometimes you direct spread to the jaw bone. I have to mention here, this is very rare condition and mostly associated with systemic disease. And this is important to consider these osteomyelitis or these specific types of osteomyelitis if there is systemic condition. There are suspicion in case of the diagnosis. So let us start with the tuberculosis osteomyelitis. As we know that the tuberculosis is the disease of the lung. That means the target of the causative microorganism is the lung. But the infection might spread from the lung to the jaw bones or even to the vertebrae, particularly the spine of the vertebrae. So this spread through the hematogenous route, through the blood, infecting the jaw bone. The causative microorganism is Mycobacterium tuberculosis. Actually, here, the clinical feature of tuberculosis osteomyelitis sometimes similar to that of the pyogenic type osteomyelitis. There is facial swelling, there is abscess, or particularly it is similar to dentoalveolar abscess. So tuberculosis osteomyelitis gives similar feature to that of the dentoalveolar abscess. There is pus or abscess formation, there is lymphadenopathy, enlargement of the lymph node, cervical lymph node. But the lymph node usually discrete or matted, and also they are not tender to percussion, or they are not tender. So this is the most important feature to differentiate between dentoalveolar abscess and also the feature of tuberculosis osteomyelitis. In case of tuberculosis osteomyelitis, there is feature similar to dentoalveolar abscess. There is abscess or pus formation, and also there is lymphadenopathy, but the lymph nodes are non-tender. This is very important. The second point here that the tuberculosis osteomyelitis are very rare to infect the jaw bones. Why? Because the Mycobacterium tuberculosis usually is inhibited by the saliva and also the intact oral mucosa. The intact oral mucosa prevents the spread of the infection Mycobacterium tuberculosis to the jaw bone. But if there is a breach in the oral mucosa, or if there is incision or wound injured, so in this case, it may facilitate the spread of infection by inoculation. Direct inoculation of the Mycobacterium to the jaw bone. But usually, the Mycobacterium tuberculosis spread through the hematogenous spread from the lung to the jaw bone. The diagnosis, medical history is very important because this is associated with systemic disease. So also taking a swab from the infected region to isolate Mycobacterium tuberculosis. The treatment is tuberculosis drugs, medicament, or medications. This is to treat the systemic condition, and if there is large sequestration, so it may need surgical operation to remove, or sequestrectomy to remove the large piece of sequestration. This is condition, as we can see, the clinical condition similar to that of dental-alveolar abscess. Also, there is pus, discharge, and sinus plaque, and also the infection usually, in case of tuberculosis osteomyelitis, infect the mandible more than the maxilla, and the spread of the infection through hematogenous route. Another condition called syphilitic osteomyelitis. It is associated with syphilis, and it is difficult to differentiate from pyogenic osteomyelitis. If it's infected the maxilla, it may cause perforation of the palate. If it's infected the mandible, in this case, it may cause perforation of the cortex. The causative microorganism is Treponema pallidum. It usually occurs in the secondary or tertiary phase of syphilis. Actually, here also we can see, although it is rare condition, but sometimes we can see massive sequestration. The treatment is by giving erythromycin or penicillin and sequestrectomy to remove the massive or large sequestration. The other condition, it is called actinomycotic osteomyelitis. Actually, actinomycosis, it is the infection of the facial soft tissue. Usually infect the soft tissue of the face, but sometimes the infection may spread to the jawbone directly or through the hematogenous spread. The causative microorganism is Actinomyces israeli. Treatment, it can be treated by penicillin or tetracycline. If there is large sequestration, it can be removed by surgery to remove the sequestration or sequestration. Here we can see this is the facial. We can see the facial infection of actinomycosis, and the infection spread to the jawbone. We can see there is no dental infection. It is not associated with dental infection, but from the facial infection, soft tissue of the face could be spread to the jawbone. Here we can see this is the pus discharging in the area, and also here taking a swab by using the paper point actually in order to take a swab to isolate the causative microorganisms Actinomyces israeli. So this is the end of the lecture, and thank you for your attention.